Alright, in this audio we will begin with meningitis. Meningitis is an inflammation of the meninges, specifically the pia mater and arachnoid. Organisms enter the central nervous system through the bloodstream, or they can be directly introduced to the central nervous system by surgical procedures, trauma, or a ruptured brain abscess. Basilar skull fractures can lead to meningitis as a result of direct communication of cerebral spinal fluid with ear or nasal passages. Otorrhea is ear discharge, and rhinorrhea is nasal discharge. With basilar skull fractures, the discharge is actually CSF. Individuals with infections of the head or the neck are at an increased risk for meningitis because of the proximity of the closeness. Increased intracranial pressure can occur as a result of blockage of the flow of cerebral spinal fluid in individuals with meningitis. Viral meningitis is the most common type of meningitis. Treatment includes the administration of antiviral agents. Meningitis can be viral, bacterial, fungal, or protozoal. Bacterial can be spread, so it's important to screen those patients that are living in nursing homes or those patients that are homeless or living in tight quarters. Neisseria meningitis or meningococcal meningitis is a medical emergency, and for individuals aged 16 to 21, it offers the highest rates of infection. Individuals in contact with those that are affected should have prophylactic treatment. Signs and symptoms of meningitis include fever, nuchal rigidity, photophobia, phonophobia, headache, and myalgia. Myalgia are muscle aches. Nausea, vomiting, confusion, and altered consciousness can be present. A petechial rash is associated with Neisseria meningitis. Older adults, those who are immunocompromised, and those receiving antibiotics may not have the typical fever associated with meningitis. We want to assess these patients for signs of increased intracranial pressure. If left untreated, intracranial pressure, an increase in intracranial pressure, can result in herniation of the brain and death. It's important to know that early changes that are indicative of increased intracranial pressure include lethargy, irritability, slow decision making, and abnormal social behavior. So early changes typically involve mental state problems. Pupillary changes and headaches can occur. Late changes would be when there's something known as Cushing's triad that occurs, and the triad includes raised blood pressure, slow heart rate, and a widening pulse pressure. Pulse pressure is the difference in systolic versus diastolic. And this triad is known as Cushing's triad. Seizures can occur due to inflammation. Inflammation can also cause the hypothalamic area to be stimulated, which can cause excess of antidiuretic hormone. An excess of antidiuretic hormone, or vasopressin, causes water retention and can cause an increased sodium loss. This is syndrome of inappropriate antidiuretic hormone. This is an endocrine system disorder, and we will cover it near the end of the term, but do know that it can occur with meningitis. Systemic inflammatory response syndrome, or SIRS, can cause a rapidly falling blood pressure and tachycardia. Coagulopathy can occur, so you should assess the patient's color and temperature of extremities and peripheral pulses. Lab tests used for analysis of meningitis are, of course, the lumbar puncture to analyze the CSF. Broad spectrum antibiotics should be given before the lumbar procedure. CIE is indicated if the patient has received antibiotics before the CSF was obtained. CSF is the presence of viruses or protozoa. CIE determines the presence of viruses or protozoa. Interventions for meningitis: prevention by vaccination, hand washing, that's a national patient safety goal. Nursing interventions for patients with meningitis include monitoring and documenting the neurologic status. The neural status should be monitored every 4 hours or more if indicated. Priority care is to monitor for increased intracranial pressure. I want you to read the chart on page 865. It's chart 42-9. Cranial nerve testing is included as a routine neural assessment. Cranial nerves 3, 4, 6, 7, and 8 are important. A sixth cranial nerve defect can indicate the development of hydrocephalus. Hydrocephalus is when there's an excessive accumulation of cerebral spinal fluid in the brain's ventricles. Urinary incontinence can be a sign of hydrocephalus because of loss of consciousness. Broad-spectrum antibiotics are given until the causative organism is defined. Bacterial meningitis often requires a 2-week course of IV antibiotics. Complications associated with meningitis: the individual can suffer vascular compromise, so we have to check the extremities because of thrombotic or embolic complications. Vascular compromise is most commonly seen in the hands. Septic shock, acute respiratory distress syndrome, and septic arthritis are also complications of meningitis. Standard precautions should be used for meningitis unless it is the bacterial type. The 2 bacterial types are N or Neisseria meningitis and H influenza. With those, the patient should be on droplet precautions. If you do not know what consists of standard contact, droplet, and airborne precautions, then you need to look those up because you'll need to know those for the NCLEX. Also, if you do not know the order in which you should apply your personal protective equipment and take off your personal protective equipment, you should look that up. Encephalitis is the next disease process that we'll talk about. Encephalitis is inflammation of the brain tissue and surrounding meninges, and when the virus reproduces, that's when the inflammation occurs. Typically, encephalitis is viral, and it travels to the central nervous system via the bloodstream. Viral encephalitis can be life-threatening or lead to neurologic problems. Degeneration of neurons occurs, and white matter in the affected area is destroyed, which can lead to hemorrhage, edema, necrosis, and the development of small cavities. Widespread edema can lead to increased intracranial pressure, so be sure to monitor for increased intracranial pressure in patients with encephalitis as well as meningitis. Arboviruses can be transmitted through bites from infected mosquitoes or ticks. West Nile virus is caused by an arbovirus, and it can lead to encephalitis. The incubation period is 2 to 15 days. It can be transmitted through breast milk. Typically, the patient's asymptomatic, or they can have mild flu-like symptoms. Serious symptoms consist of high fever, severe headache, decreased level of consciousness, tremors, vision loss, muscle weakness or paralysis, and seizures. Meningeal irritation can cause nuchal rigidity, weakness to paralysis, or seizures. The typical patient presents with high fever, reports of nausea, vomiting, and a stiff neck. Herpes simplex virus type 1 poliovirus, herpes zoster virus, and viruses that can cause mumps and chickenpox are associated with encephalitis and are known as enteroviruses. Mortality rates are higher in patients with the herpes simplex virus type 1. Amoeba can cause encephalitis as well. And the increased incidence of amoeba causing encephalitis is related to water pollution. Lumbar puncture is done to analyze cerebrospinal fluid. We want to make sure that we're teaching these individuals to limit time outside between dusk and dawn when mosquitoes are out, use insect repellent, and remove areas of standing water to prevent mosquitoes from harboring. Acyclovir is used for encephalitis caused by the herpes simplex virus. There is no specific drug therapy for arboviruses or enteroviruses. It's important to remember to maintain a patent airway and monitor for increased intracranial pressure. In patients with encephalitis, we want to make sure that we keep that room quiet and darkened to improve comfort. In the next audio, I will begin with Parkinson's disease.